Good day, colleagues from all over the world. It's very nice to welcome all of you to this important moment in our global effort to combat ageism. I'm Etienne Krug, and I'm Director for Social Determinants of Health at the World Health Organization's headquarters in Geneva. Very happy to have you here with today's launch of the new Ageism Measurement Scale. We're taking a crucial step towards understanding and hopefully changing how societies treat people of all ages. Ageism is probably one of the most widespread and socially accepted forms of prejudice. It affects older and younger people, and it influences how we think about others and ourselves. It shapes our policies, our services, and our laws. There's many examples. Every day we're facing ageism, and very often we don't even realize we are facing it. Older workers are less likely to be hired or promoted, while younger workers are often viewed as inexperienced or unreliable, regardless actually of their skills. In healthcare, older adults are often excluded from clinical trials or offered fewer treatment options, even though they actually carry the greatest burden of disease. This isn't about biology, it really is bias. And these are not isolated incidents. They reflect systemic ageism throughout our societies, our countries, our communities. As with many issues, what we don't measure, we can't change. This new scale is going to be a game changer because it's going to allow us to systematically measure stereotypes, prejudice, and discrimination based on age. It will help us understand where ageism is most common, how it shows up, and who it affects the most. So this new tool allows us to see what was previously hidden and hopefully will allow us to take action on this very important issue. It's been developed through a global collaboration with scientific rigor. It's a tool that can be used by policymakers, but also researchers, civil society, advocates. We can track progress and hopefully better inform policy and target our responses to where they are most needed. With this scale, we're going to make the invisible visible. We can develop smarter, more targeted strategies to reduce ageism and promote healthy aging for all. So a big thanks to the team who worked on this, Aja and Shufei at the University of Edinburgh, but also my own colleagues, Alana, Chris, Vanya, Kazuki, and Alexia in WHO, who have worked very hard for several years on this important project. Let's ensure this scale is not being just launched today, but is going to be used. Nothing is more saddens me more than having a WHO document that stays on the shelves. I hope it's going to be a tool for many of you, and I think the turnout in this webinar is a testimony to that, in order to measure ageism better and use it to change. And we can change ageism. We don't just improve individuals' lives, we can build better and fairer societies by using this tool. So thanks for being there. And I'm delighted to introduce to all of you Alana. Alana Officer is the head of our unit on demographic change and healthy aging, who will take us forward in this webinar. Thanks to all.
Thanks so much, Etienne. Great to have you with us. All right, so welcome all. Fantastic to see you. Can you just pop onto the next slide, Alexia? So what we're going to cover today, going to give you a quick overview of the global campaign to combat ageism, some key insights into why a new ageism scale is needed. We're going to introduce that scale. We're going to learn from field and lived experiences of using the scale, and then you're going to get a sense of how you can take it forward. So the next slide, please. All right. So the global campaign was in fact called for in 2016. So member states asked WHO to develop, in collaboration with others, a global campaign to combat ageism. The vision of that campaign is a world for all ages. And really its mission is to change how we think, how we feel, and how we act towards age and aging. Next slide, please. The campaign works on three main areas: improving data and evidence, raising awareness, and building a global movement or a coalition to drive this work. Next slide, please. So when the UN decade was adopted, ageism was identified as one of 4 of the priorities. So it's relevant on its own, but it's also particularly pertinent for the other 3 key action areas of the decade. If you go forward, next slide. So at the start of the decade in 2021, WHO, OHCHR, UNFPA, and UNDESA launched the Global Report on Ageism. So it defines what is ageism. And if you move to the next slide, it says that ageism is how we think, so our stereotypes, how we feel, prejudice, and how we act towards others or towards ourselves based on age. We know that ageism affects people of all ages. Fortunately, we're not born ageist, but it starts very early and tends to be reinforced over time. So children as young as 4 are aware of their culture's age stereotypes and prejudice through the storybooks that we read to them, the media, and their family culture. These stereotypes then become internalized, and they're used to guide our feelings and behaviors towards people of different ages, but also towards ourselves. And ageism exists in all aspects of our lives, whether it be in our institutions, in our relationships with other people, or in ourselves. But it does tend to take on different forms across the life course. Etienne gave some great examples, but other examples of stereotypes are, those young people, they're addicted to their phones, they don't care about the real world. Or older people, they're so slow, they can't learn new technology. Whereas prejudices that we tend to get, feeling older people are a burden, should make way for younger people, or being dismissive of younger workers because they somehow lack experience. And discrimination, as Etienne said, whether it being denied jobs or opportunities for advancement, or even denied healthcare. And the report, using the best available evidence that we had at that time, found, and if you go to the next slide, that 1 in 2 people, or half of the world's population, had moderate to high ageist attitudes towards older people, with rates much higher in low and middle income countries. For younger people, where we had more limited data, and you can see this from the next slide, because in fact, it was only in Europe where we had comparable data of all different age groups. Younger people tend to report more age discrimination than other age groups. We also looked at what were the determinants of ageism. And so if you go on to the next slide, you'll see that you're more likely to be ageist against older people if you're younger, male, anxious about death and dying, and less educated. There are certain personality traits, and having more intergenerational contact tends to reduce the likelihood of perpetrating ageism. You're more likely, however, to be a target of ageism if you're older, you're in need of care, if the country in which you live has a lower healthy life expectancy, or you work in certain professions. Being female means you're more likely to be targeted or a target of ageism for younger people. You may ask, and it's an important question, is ageism, which is incredibly prevalent, also harmful and costly? So if you go on to the next slide, you'll see that it has far-reaching impacts on all aspects of people's health, their physical and mental health, social well-being, their ability to recover from disability. But it also intersects and exacerbates other forms of disadvantage related to sex, race, and disability. And it has a really heavy economic toll, both on individuals and on our societies. It also tends to erode solidarity between our generations, and devalues and limits the ability for our societies to benefit from the abilities of both younger and older people. If you go on to the next slide, the report is really optimistic in the sense that it says we can combat ageism, There was evidence around 3 strategies that work: policy and law, educational activities, and intergenerational activities. We know that policy and law can address discrimination and inequality on the basis of age. It can really protect human rights of everyone, of all ages. Educational activities tend to be really good at enhancing empathy and dispelling misconceptions about different age groups, while intergenerational actions bring people together and can help reduce intergroup prejudice and stereotypes. So these are the most effective interventions, and they work better if you can implement all of them at the same time. So the report had some key recommendations on the way forward, and it said that you should be investing in these evidence-based strategies, improving data and research, and we're going to get to that in discussing the scale, and really to try and build a movement to change the narrative around age and aging. So if you go on to the next slide. So as I mentioned, the campaign works on these 3. I know many of you you're here for the scale, and we're going to talk about it, but I know that you do many other things also to prevent and respond to ageism. So I'm just going to run you through some of the other tools very briefly. If you go on to the next slide, please, Alexia, and the next one. So in addition to the report, you've got the report and summaries in various different languages. In addition to that, we have an incredible toolkit, if you just keep going forward. And within that toolkit, we've got guides to how you can have conversations around ageism in various different languages. We've got examples of how you can run events on using the report. You've got a standard presentation that you can take advantage of if you want to. We've also got a number of social media tools, for example, some films that you can use if you want to communicate better around ageism. There's also, moving forward, you've got some evidence-based infographics. Exactly. These also in a variety of languages, and as well as some emotional-based infographics, depending on your audience and how you're trying to communicate. We've also got other tools. If you go forward. Such as how can you avoid ageism in the way that you communicate or in the photos and images you use. And on the Decade platform, there are a large number of resources where you can both access resources, but also share your own resources on ageism, which provides a wealth of information. If you just go to the next one. And in terms of evidence and data, just going forward. So we've got guidance on AI and how ageism plays out within artificial intelligence. So trying to keep abreast of emerging issues and the impact of ageism on those. But there's also a more recent guide, which is on how you can foster intergenerational solidarity by working through intergenerational practice. That guide's a very practical one around how you can plan, implement, and evaluate intergenerational practice. And lastly, just to say, if you want to, we track progress on the work that we're doing around the Decade and also on the campaign, because the campaign really serves as the mechanism for addressing how we think, feel, and act towards age and aging as part of the Decade. And we are making good progress, you know, so we saw an increase in countries reporting national legislation that addresses discrimination by age. So 83% in 2023, which was up from 60% in 2020. So great progress. If you go to the next one, we're going to get to what you're most interested in, which is, and what you're here for. But just a reminder, there's a lot of other resources. And now I want to pass over to Asia Murray, who is an associate professor in psychology at the University of Edinburgh in the UK. Her research, in fact, takes a developmental perspective to illuminating health, including mental health across the lifespan. and she is the co-developer of the WHO Ageism Scale. And I'm very grateful to Asia, and over to you.
Great, thank you so much, Alana. So we've obviously heard about the widespread implications of ageism. So what I'm going to do now is introduce the WHO Ageism Scale and discuss how that can play a role in efforts to combat ageism. So I'm going to start by discussing why measurement is so critical to combating ageism, then introduce the scale, discuss how it was developed, talk about what it actually measures, give some examples of how it's been used already, and then discuss what are the next steps, including how others can adopt the scale in their work and support these efforts. Next slide, please. Thank you. Okay, so measurement is super, super important for combating ageism. If we don't have an accurate measure of ageism, according to how we understand ageism, all its different components, then it's really difficult to know with any certainty actually what is the scale of the problem globally, and then breaking that down, who's most affected, for example, which people, which regions, which contexts, which settings is ageism most prevalent in. Similarly, it's really difficult to have solid evidence about what's driving ageism, what are its consequences at an individual and societal level, for example, the economic costs, and then perhaps most crucially about what interventions, whether that's policy, programmatic, different types of interventions, what is actually effective for reducing ageism. If we can't track that, we don't know if our efforts are actually effective or not. Next slide, please. Okay, so what we specifically need is we need a measure of ageism that can capture ageism in all of its dimensions. So we heard before about how ageism is defined according to stereotypes, prejudice, and discrimination, reflecting how we think, how we feel, and how we act towards people on the basis of their age. And then it has manifestations at different levels. It can be self-directed, interpersonal, institutional. So we need to be able to capture all of this, but more than that, we need valid and reliable and also comparable measures that can be used across the world, because it is, after all, a global issue. We know very well that the consequences of ageism against older adults are very negative, but we also know that it doesn't just affect older adults, and we need measures that can capture ageism as it applies to different age groups, to all age groups. And finally, we need measures that can capture not just people's experiences of ageism, but also their ageism towards other people. And actually, as it turns out, these things are quite interconnected. So to meet this need, next slide. To meet this need, we developed and validated the WHO Ageism Scale because there were no pre-existing measures that could tick all of these boxes and provide that global measure of ageism to help underpin efforts to combat ageism. So it was a multi-stage process. We started with a conceptualization stage, which basically means agreeing on a definition for ageism that would underpin the scale. And that's where we determined that it would need to have this multi-dimensional nature to it, all of the things I described on the previous slide. Then, on the basis of that conceptualization, we generated a very large number of items that could measure ageism experiences and ageism towards all different age groups. That was done crucially in collaboration with experts in ageism and scale development, drawing from all over the world, to make sure that we could develop something that is going to be globally applicable. Then from that item pool, the next stage was to develop the WHO Ageism Scale in English. At present, we have scales that cover experiences of ageism and ageism towards older persons. And in the future, we'll be looking at developing scales that also capture ageism against other age groups too. And then the final step in the process is to take those scales and to translate them using gold standard procedures into different languages and to do psychometric validation studies across the world to check the psychometric properties of those scales across different country settings and languages. Next slide, please. So I'll focus in a bit more on the WHO Ageism Experiences Scale, reflecting people's experiences of ageism directed towards themselves, because that's where we've made the most progress in the validation so far. So that's available in 5 and 15 item versions and measures self-directed, interpersonal and institutional ageism, covering the domains of stereotypes, prejudice and discrimination. So example items would be things like at my age, my life has plenty of purpose. So that's a self-directed ageism item. We have others feel frustrated with me due to my age, reflecting interpersonal ageism. And we have people my age are portrayed positively in the media, reflecting institutional ageism. Next slide, please. So this map shows our progress towards a globally validated scale. So the yellow dots are locations where we have gone through the whole process of translation and validation, and we have tested the scale fully in these contexts. And the blue dots represent the locations where that is in progress. Either we've collected the data and are analysing it, or the data collection is in progress or in the planning stages. Next slide, please. What we've learned from this process so far is, crucially, we have been able to translate the scale successfully into not just the six official UN languages, but also many more languages with few issues beyond the kind of normal issues about ambiguities and debates about that you see in the translation process. And that's probably reflecting the fact that from the very beginning of the process, we wanted to develop something that would be globally applicable and translatable. And we paid a lot of attention to making sure that we had a set of items that would meet those properties ultimately. Where we've collected data, we found that the psychometric properties of the scale are good. So that includes showing good reliability, including internal consistency and test-retest reliability. It's shown good convergent validity with other measures of ageism, meaning that we see the expected correlations between WHO measure and pre-existing measures of ageism. It's shown good concurrent validity, meaning that we see the expected pattern of associations between the scale scores and factors that we already know we expect to be related to ageism. So it correlates with things like loneliness, well-being, mental health, physical health, these sorts of things. Really importantly, we find it to be acceptable for older persons to complete the scale. It's obviously a very negative concept, so it's important to think about how it's going to feel for participants taking part in a study and having to answer questions about their experiences of ageism. But what we found is that older adults find this okay, probably because we have a mixture of both positively worded items and negatively worded items to help provide a bit of balance. So beyond the kind of basic psychometric properties, we've also found that the scale has been capable of yielding new insights into ageism, and we'll see some examples of that with a case study in a moment. And having just recently re-reviewed the literature, it remains the case that the WHO Ageism Scale is the only scale that really meets all the necessary criteria to provide this global measure of ageism that captures ageism as it's currently understood, and that can therefore underpin our efforts to combat ageism across the world. Next slide, please. Okay, so now how it's being used. So to give you some examples of how it's already being used, it's been used recently to look at the links between ageism and the age-friendliness of cities and communities in Colombia, and Marcela will tell us more about that in a moment. It's been used to look at the ageism experiences of Ukrainian refugees in Moldova. It's been used by our colleagues at Red Cross to test an arts-based intervention designed to reduce ageism. It's been used to illuminate the experiences of ageism among participants in flood-affected regions of Libya following the floods in 2023. Also demonstrating its utility as a measure for illuminating ageism in humanitarian contexts as well, which is really important. It's been adopted as part of the HELO consortium, which is a consortium of studies across the world that's looking at healthy aging, and that's helping us to illuminate the links between ageism and healthy aging. It's been included in the 3LC study in Lebanon, where it's going to be possible to learn about the links between ageism and lifelong learning. And then at the same time, we're in various discussions, we have various plans for the inclusion of the WHO Ageism Scale in national and cross-national studies, which will give us an opportunity to learn more about ageism and its interconnections with health and other important outcomes and determinants at a national and cross-national level. Next slide, please. Okay, so what's next then? So there's two key areas of focus for us next. The first one is to continue to build on the work that we've done to further expand our ageism measurement capability. And the second is to leverage the new WHO Ageism Scale to contribute to building a more robust evidence base that can underpin efforts to combat ageism. Next slide. Okay, so in terms of continuing to build our measurement capability, as I mentioned before, although we have done a lot of work looking at a scale to measure ageism experiences, it's important to be able to capture ageism that people might direct towards others as well, to view it from both perspectives. So to that end, we've also been working on the WHO Ageism Towards Older Adults scale, which is a 15-item scale currently validated in English and Spanish, and we're in the process of validating other languages as well. It has items such as older adults have a lot to contribute to society. I feel frustrated with older adults. I avoid spending time with older adults. And as I mentioned before, ageism doesn't just affect older adults, so we're also in the future going to look to developing and validating versions of the scale that can be used to capture ageism towards younger age groups as well, from adolescents upwards. Next slide. Thank you very much. And in terms of leveraging the new scale, so having a measure now that can capture ageism in all its dimensions can help kind of unlock the potential to learn new things about ageism, and help advance our knowledge of ageism and how to reduce it. We can do this by incorporating the WHO Ageism Scale within our research projects and our monitoring and evaluation efforts. This could be from including it in small-scale studies that might be quite specifically focused on ageism, all the way up to national and cross-national surveys, which might not have ageism as a sole focus, but which provide an opportunity to understand the linkages between ageism and other important factors. It's an obvious use case for it is to include it as an outcome in evaluations of interventions to reduce ageism. But because we know that ageism is quite interconnected with other aspects of healthy aging, for example, we'll hear soon about how it's related to the age friendliness of cities and communities, it's also relevant to consider the WHO Ageism Scale as a potential secondary outcome in intervention evaluations more broadly focused on healthy aging. If we do this, if we embed the WHO Ageism Scale within our research and within our monitoring and evaluation, it's going to put us in a really good position to better understand what is the prevalence of ageism globally and locally, what's its patterning. For example, we can learn more about intersectionality, which is something that we really need more evidence on, actually. It can give us a more solid understanding of the determinants and consequences of ageism at the individual level, up to the societal and global level, and perhaps most crucially, help us to understand what are effective interventions to reduce ageism. Next slide, please. Okay, so next I'm going to hand over to one of our case studies, which explains how the WHO Ageism Scale has been used to explore the links between ageism and the age friendliness of cities and communities in Colombia. And for that, I'd like to hand over to Marcela Bustamante from Health Age International. Thank you very much, Marcela. If you want to take it away.
Yes, thank you, Anya. Good morning to everyone. I am speaking from Colombia, and let me share my presentation, but I am not available. I don't know. Sophie, could you please show my presentation? So I am going to share the key findings. The next one, please. The next slide, please. Great, here, before. The previous one. As I said, the caveat in this exercise was the implementation of a set of indicators regarding the age-friendly cities and communities domain. We can see here housing, we implemented indicators regarding housing, social participation, respect and social inclusion, civic participation and employment, and so on. The next one, please. But we also included several scales that were tested in previous exercise in another regions to test or to measure the social status, physical and mental functioning, health, well-being, loneliness, and also we included questions regarding intergenerational contact. In this stage, as I wanted to also to highlight the collaboration between the University of Edinburgh and also 4 Colombian universities, as well as our social partner in Colombia. The tools, the survey, the scales are available here in English and in Spanish. Now the next one, okay. Regarding Colombia, we are based in South America, and there are over 52 million people in Colombia, and from them, 7 million are over 60 years old. And almost 400 people, older people, participated in this exercise based in different cities, Barranquilla, Colombia, in the north, in the Caribbean, and also in Ibagué and Bogota, the capital city. The next one, please. Okay, about the methodology, okay, we just said almost 400 people participated. It was carried out through in four cities, and it's important also to highlight that 14 old people association participated in this survey, and how important we are going to listen some of the voices of older people who participated, but it was important also in this interview on this space to listen the people voice. So the next one, please. Okay, there was an average age of 72 years old from the participants that compose the sample, and the female participants make up 3/4, and we can see that the sample was a very rich in terms of ethnicity group. We have indigenous, we have Afro-Colombian, white, mestizos, and Rom, thanks to our local partner. And it was one of the key lessons that I am going to share after sharing the key findings, that how important it is to work with local partners and to guarantee this diversity, not just in terms of geographic, but also in terms of ethnicity. The next one, please. Almost 40 or 50% of the sample didn't complete their primary education, and almost 60% of the participants had an income of less than $150. And I just wanted to say something in this stage, is that regarding the translation of the sample, because of the low scholarity of older people, it was also our lessons learned. It is important to make simple the language of the survey, and it's still a lot of work to do to simplify the survey, but it's one of the lessons learned. Given the low scholarity of the participants, it's important to make simple the instrument, the tool. The next one, please. Okay. Regarding the data and the key findings, we classify the key findings like in three categories. The first one is establish the correlation between ageism and age-friendly cities. The second kind of analysis was the link between age-friendly cities and health outcomes. And the last one is the link between ageism and health. So I am going to try to share the key findings of each group. So the first one is ageism and age-friendly cities correlation. Colombians are mostly satisfied about the age-friendliness of the cities and communities. The people who experience the high level of satisfaction regarding the friendliness, the age friendliness of the communities are the people who are less experienced ageism. So the more you are happy with your environment, the less experienced ageisms. Self-directed and interpersonal ageisms were most strongly linked to less civic participation, employment, social participation, not feeling respected and included. And also social conditionants like disability, low education, low income have impacted also the experience of ageism. The next one, please. Great. Here, the second category, the association between age-friendly cities and health outcomes. Older people who view their environments are more age-friendly tend to report a better physical health and psychosocial well-being. Physical health and psychosocial health were positively associated with almost all age-friendly cities domains, but domains including respect, social inclusion, community support, and health service reported a negative link to loneliness and obviously impacted physical, psychosocial health. The next one, great. Ageism and health. Institutional ageism is the most prominent in Colombia through policies and institutions regarding health. Obviously, ageism impact health. Higher level of ageism experience correlated with poor physical and mental health, increased loneliness, and lower well-being. And here it's important also to highlight how important are the intergenerational interactions. All people who have reported more interaction with young people and with other age groups are the people who reported less ageism exposition. And almost all participants felt that TV, advertisements, social media reinforce a stereotype about older people being sick, unable, incapable, and dependent. The next one. Okay. Regarding the processed cells was very rich, first of all, because have a strong local roots thanks to our local partners. The Red Coembe is a national network led by older people at national level, but very good connected with several old people association across the country, and that was the key to to ensure a sample that have different representation from different cities, and also having working with local universities enrich the dialogue between Colombia and Edinburgh. And also important the intergenerational engagement with students, because the students from the four universities were enumerators, but also are going to be the future professionals. So, and this exercise, the involvement of these students raise awareness in this early stage about the issue of, of being all without appropriate public policies. And also the team from HelpAge and company the work in two cities. The future, the next slide, please. Great. The research, there are several challenges that still need to be addressed. It is important to keep exploring and investigate the long-term effect of ageism, and also keep analyzing the different intersection between ageisms and different social determinants, like gender, disability, ethnicity, socioeconomic status, because impact the life of older people and are more exposed to ageism regarding the gender and so on. It's important to consider the framework of age-friendly cities and communities as an important one to tackle the ageism, because working in the friendliness of the cities and communities is a way to combat ageism. And we just applied a pilot in Colombia of 400 participants, but it's important to keep a scale up and to have data and evidence, because as was highlighted at the beginning, it's important to combat the ageism based in evidence and data. About the advocacy, it's important also to keep doing this kind of gathering exercise and gathering evidence and testimony to inform all advocacy efforts, and also important to combat the narrative that reinforce the stereotypes, showcase different lives of older people and different voices and how they contribute in the communities. And also it's important this kind of coalition between researchers, universities, policymakers, NGOs, really to achieve a change. The last one, please. Great. About the communities, our recommendation, I just wanted to mention again how important is that in the communities there are a space to convene different voices and to facilitate the intergenerational connection between older people and all agents groups to tackle the ageisms and to exchange knowledge and practice. And it's also important that from the local level also encourage the local authorities to join the age-friendly cities and communities movement. And probably the last but not least point is that it's important to target older people needs in combating the ageism, like people who are in disability and or people who live alone or in isolation. It's important also to have in the radar the different needs of older people. I stop here, and you are welcome invited to see an interesting video from different voices of all people who participated in this sample. Thank you.
Como experiencia particular de participar en el proceso de trabajo con las organizaciones, con los grupos organizados de personas mayores y hacer la articulación entre la academia y el saber popular, creo que es una parte súper importante en el trabajo con las personas mayores en este tema de envejecimiento saludable y hacer reconocer las personas mayores como sujetos, más no como objetos sistemáticos de observancia y de investigación. Creemos que tenemos que en las próximas investigaciones seguir en el tema de que ellos sean parte, tomen parte de sus propias opiniones y que sean valoradas sus opiniones, sus experiencias en el trabajo con la comunidad y también que la academia los reconozca a ellos como sujetos en el tema de envejecimiento y vejez. Entonces creo que esta experiencia fue muy valiosa, muy interesante y proyectándola hacia políticas públicas, creo que tenemos unas herramientas bastante valiosas para proponerlas a los nuevos gobiernos, a los entrantes, a los salientes y que quede algo en los escenarios de participación grandes que tenemos como el Consejo Nacional de Mayores y consejos locales de personas mayores.
Porque es la primera vez que se gesta una encuesta con puño y letra y pensamiento del adulto mayor, aquel que tiene que decir de él lo que no debe decir nadie porque no es adulto mayor. Hubieron personas que usted no me va a creer, pero aunque no supieran leer, daban su opinión y eran escuchados de tal manera que muchas de las cosas que aparecen en la encuesta hoy por hoy fueron precisamente de esas personas y nosotros defendemos esos criterios. Esa encuesta fue un éxito. Se hizo con grupos organizados de la sociedad civil y con centros de vida. Nosotros nos sentimos satisfechos de decir en esa encuesta lo que debimos decir hace mucho tiempo y ojalá no nos vaya a quedar corto en cuanto a la opinión ante los estamentos de la nación y el mundo. Creemos que debe haber una política reivindicante, pero con participación activa de los actores principales, que son las personas mayores, como sujetos de derecho para opinar y para participar en todos los elementos que a él le afecten directa o indirectamente.
We'd like to move on to the panel Q&A. And just to mention to everyone that we would like to thank all of you for submitting your questions. As you registered for the webinar, we received over 120 questions actually. And from those questions, we grouped them into the most common themes, and they will feed into the FAQs for the Ageism Scale, which we will put on the Ageism webpage. But we wanted to, at this point, run through a few of the most common questions that we received in the Q&A, so we can discuss them as well during this webinar. So if you could please show the first question. How can I use the scale? So we've been posting the link to the Ageism Scale throughout it, but I'd like to pass on to Asia and Alana, who can go take us through some of the most common questions around usage of the scale, where you can access it, what are the copyright issues, how can you translate it, and how can you collaborate with the research teams that have been involved with developing the Ageism Scale. So Alana, Asia, over to you.
Asia, do you want to kick off?
Sure. So in terms of accessing the scale and associated materials, that's now available and posted. And as we continue to have other translations available, that will also be made openly available as well. In terms of permission to use, it's not necessary to ask permission to use the scale. It's out there in the public domain. And in terms of translation, we do provide some guidance on how to translate it according to best practice guidelines as well, because it would be great if it can be translated to the highest quality. In terms of collaborating, just speaking for myself and my team for the moment, and I can pass over to Alana from WHO's perspective, we're very happy to support with translations and validations, so feel free to reach out to our team if you'd like some support with that or to collaborate otherwise. Anything to add, Alana?
No, I think that's fantastic. And, you know, the University of Edinburgh has been our sort of key technical partner in this work, is still there to support you in your translation if you wish to do that. But have a look on the site. There's already a number of languages available, and there's very clear guidance in the manual on how you can translate. But yeah, we've got resources there to support you if you want to take this forward.
Thank you so much, Alana. Shall we move on?
Yeah, sure.
Yes, let's move on to the next question. Can you use the WHO Ageism Scale in different countries, cultures, and contexts? So, you know, we have quite the diverse audience that joined us today, ranging from Europe, obviously, but all the way to South America, to Asia. Thank you to all of you for joining, despite the different time zones. And of course, given that we have a diverse audience, I think everyone is curious about whether the scale as developed can be used across all of those diverse contexts as well. For example, lower and middle income countries, whether there are spatial drivers of ageism that can involve the scale, whether there are specificities in terms of socioeconomic, political, historical contexts in the workplace or other specific sectors, and in languages. So Alana, Asia, I think our audience are really curious to see how the scale takes into account all of these diversities.
Well, the short answer is it was designed to be as widely applicable as possible. It was designed to be applicable across different cultural contexts, to be translatable into different languages. It has been validated in obviously like a limited number of settings and languages, but we encourage its use broadly. That was what it was designed for. And that includes different cultural contexts, but also different settings. For example, one of the questions was around, can I use this in a workplace setting? We have looked at using it in, for example, humanitarian settings and things like that. Although it hasn't been validated across different settings, and that is work that still needs to be done, it was certainly designed to be used in a very broad way across different country and broader settings and contexts.
So maybe just to add to Asia, so one of the big issues that we found when we developed the Global Report on Ageism was the lack of evidence, particularly in low and middle income countries. So, which is why the testing is really focusing on very diverse country contexts. So, you know, it was great to hear from Marcella, but also, as Asia said, you know, that it's been tested in Lebanon and Libya, as well as Moldova. So really trying to first test it such that it will also be of use to any country context and any setting or sector. It's really our intent. In terms of the different languages that are already available, I think we've posted those. We've tested it in all UN languages, and in addition in Italian and Asia.
Romanian, Serbian.
Romanian, yep, Serbian.
Welsh.
Did you say Italian already? Oh, many more actually. I'm thinking, for example, as part of the HELO consortium, there's quite a few languages covered there. But they are listed, so you can look up and see if it has already been translated into your language. And if not, as Alana said previously, there's some guidance on how to translate it into different languages if a translation doesn't exist.
Thanks, Asia and Alana. And obviously, we will continue to update the web page that we've been linking in the chat as additional versions and translations come in. So please do watch out on that web page, or more advantageously, join the global campaign to combat ageism, so you can stay updated on all the different versions of the WHO Ageism Scale, as well as new materials that come out. Alana, Asia, anything else before I move on to a sub-question? No, if not, I just wanted to highlight a few questions from the live Q&A that's relevant to this context. Obviously, there's a lot of excitement and enthusiasm from different parts of the world to apply, validate, test, translate the scale. And there's been a question about how do we learn about other efforts that are being made across the world. For example, there may be 2 groups in Italy that is interested in validating the scale, for example. How do they make sure that they don't overlap or duplicate results. And a related question was, for example, are there plans afoot to create a database of in progress attempts, or starting new translations, new tests in various countries? Will there be a way for people to check what is in progress? So Asia, Alana, if you have any inputs on this.
So that's a really good idea. We don't currently have a list or repository, but it's a great suggestion. I think for the time being, the easiest way would be actually just to reach out, and I think we'll probably take that suggestion on board and look into setting up somewhere that people can look up and see what the ongoing work is actually in the stage of progress. It's a great suggestion.
Yeah, fantastic. As you'll see on the site, we do have the various different translations available. And we did suggest that, in fact, if anybody wants to translate, to reach out. We've provided both the Global Campaign email address and Asia's email address. So feel free to reach out to to ask if a translation is already underway.
Thank you so much, Alana, Asia. Shall we move to the next question, please? Yes, this is a good one as well. What are the psychometric properties of the scale? How robust is it? Where can I find the psychometric properties for the scale? And what are the limitations, given that the psychometric validation is one of the key selling points, I think, of this WHO Ageism Scale? So Asia, maybe if you had something to say about this in particular.
Yeah, that's a really important question. So far, when we've tested the scale, it has shown to have good psychometric properties in terms of things like reliability. We've looked at the content validity in collaboration with experts on ageism from across the world. It's showing good convergent and concurrent validity, so associations with other measures of ageism. Difficulty there is there isn't a pre-existing measure of ageism that can look at all of the different dimensions of ageism. So that is a little bit of a challenge. And then, yeah, in terms of convergent validity, it does show the expected patterns of correlations that you would expect to see with things like physical health, mental health, well-being, loneliness, intergenerational contact, and things that we already know we should expect to be associated with ageism. In terms of the specific psychometric properties for the scale, so we are in the process of publishing various different manuscripts that go into the details of those. We have a University of Edinburgh website that summarizes those studies as well, which I guess we can put the link in the chat, or perhaps send the link out as part of the follow-up. And then in terms of limitations, again, a really good question. I think for me, the biggest limitation is that because we are developing a scale that is meant to be globally applicable, we're inevitably focusing on relatively universal manifestations of ageism. So what we're not capturing here are cultural specific or context specific manifestations of ageism. So my recommendation would be for people who are interested in looking at ageism in a particular setting, like for example, a workplace setting, or in a particular culture where you're expecting to see culture specific manifestations, that you can use the WHO Ageism Scale to get that data that's going to be comparable with other countries and settings, but then perhaps supplement it with a few additional indicators that are more setting or culture specific.
Thanks a lot for that, Asia. I'd like to pick out another question live in Q&A, which could be relevant to the question just answered, which is there a difference between prejudice or ageism based on age, or is there a difference when you look at membership of a particular generational group? This question is particularly relevant, asked in the context of the UK, for example, of the concept of baby boomers. So are we talking here about age specifically, or is there thinking around how it could apply to particular generational segments?
I mean, the scale focuses on age rather than generations, but it could be used to illuminate generational differences, I think, as well. One of the things about the scale is it is designed to be able to track ageism levels over time as well, and over generations, and so that is something that it could be used to do. And we do know that there are age differences in ageism. We know that younger age groups and older age groups experience the highest levels and in the middle, lower levels. I don't know how much we know about kind of generational differences, though. I don't know if Alana, if you know anything, how much evidence there is on that. I don't think it has been looked at quite as much, has it?
No, it hasn't been researched in the same way.
Mm,
So
mhm.
it's an interesting question.
Yeah.
We're looking forward perhaps to more further work being done by the global community to tease out the differences between the two approaches. So do we have another question group, Alexia? Yes, we do. And this is particularly relevant given we just heard about age-friendly cities and communities. So we received a lot of questions about how do we combat ageism at different levels. Some were talking about individuals, but this question is also about city level and country level, because different types of interventions could be effective at different levels of implementation. So, for example, what are cities and countries doing that you're aware of, everyone? What is the most effective way to get older adults involved in ageism discussions, and how can we create age-friendly cities? And if our panelist also wants to jump in here with her own perspectives, given the particular implementation of the scale in Colombia, we would love to hear from you as well.
Marcela, do you want to start?
Yes, thank you. I think I am very fan of the power at local level. And it's huge what the communities, what the older people association can do for themselves in combating the ageism. I just wanted to say that the age-friendly cities and communities framework offered through the 8 domains challenges, but also opportunities to tackle working together with local authorities. So that would be the message that I wanted to share. And this is why her page is working in different levels, local, national, regional, but about the community itself is a lot of resilience and resources to tackle the ageism.
So maybe building on what Marcela said, so in terms of creating age-friendly cities and communities, and maybe, I don't know whether Kazuki, you can add, we have a whole website on how you can go about assessing the age friendliness of your community, how you can think through and work with other stakeholders on defining priorities. We've got huge numbers of examples of cities and communities around the world that are already working to become much more age friendly. It's less an end unto itself and more of a process. So we can share that site so that you can have access to guidance both at the city level and national level. And in terms of the question around what's the most effective way to get older adults involved in ageism discussions, it's a great one. So we do have a conversation guide, so which starts at the individual level, you know, so to encourage those conversations. But you can also use it for policymakers or for civil society actors. We've used a lot of sort of role playing as well to be able to elucidate and showcase how ageism might play out, and then using that to promote discussions. But there's some great tools already on the website that you could use that have been used quite frequently in terms of promoting those conversations. And also in terms of, we're talking a lot about data and evaluation. If you've used any of these tools and you want to feed back about how effective they are, we would love to hear from you.
Thank you so much, Alana. Asia, anything from your end?
I think the only thing I would add is, in terms of creating age-friendly cities and communities, one of the things that we've learned using the WHO Ageism Scale is that ageism needs to be part of that. We need to consider how it can be a barrier to creating age-friendly cities and communities, and how age-friendly cities and communities can feed back positively in terms of the ageism that people are experiencing. I think that's the only thing I would add there.
Thank you so much, Asia. If I could just add, we had a flurry of follow-up questions on the city and country level question. So before we wrap up, I want to ask one follow-up question. This is from 2 individuals who recently asked this question. Is there anything being done around ageism and the differences of ageism between city and rural settings?
It's a fantastic question. There's been no comparative studies done, for example, with it's a great idea actually, Asia, in terms of the scale, and it could easily be incorporated, I think, as Marcelo's shown, you know, within age-friendly rural communities and in age-friendly cities. So certainly it could be used within diverse context very easily.
Yeah, absolutely.
Thanks so much. All right. As we wrap up, I just wanted to say a few things. Unfortunately, we were not able to resolve the issue of sharing the sound of the video until this moment. So obviously, all people who participated today will receive a link to the webinar recording. We will make sure to splice in the video with sound in that recording so you can enjoy the lived experience of the case study as presented from Colombia. So please make sure to watch that recording. The link will also go out to everyone who registered as well. And also the video will be posted on the Ageism Scale webpage that we've been linking about. So please make sure to look back, watch the discussion, and don't miss the lived experience that was shared with us, as lived experience of ageism is really important in how we measure and detect it. So can we please pass on to the last few slides, please? Next. Next, yes, we're skipping that. So Alana, please, over to you to close this webinar.
Terrific. Thanks, Kazuki, and thanks to Asia. So just a reminder that if you want to use the Ageism Scale, we would very much welcome that. We're looking for further support to validate it in different settings, in different sectors, in different languages, and in different contexts. So please do use it. It's open for your use. Spread the word. Feel free to contact Asia directly or WHO at Hello, A World for All Ages for more information about the Ageism Scale. But also, you know, don't limit yourself to data and measurement, as important as it is, but really try and, you know, sign up to the campaign, use the report and read it if you haven't already read it. There's huge amounts of tools. Please use those. If you want to translate them to your own countries and context, please do contact us. We're very open to that as well. If you're going to invest in strategies, invest in the ones that work. So intergenerational contact, policies and education. And, you know, we're really looking forward to improving data and research in this space. And we hope that the Ageism Scale will be incredibly useful to all of you. We really hope that it will move things forward in terms of shaping research, in terms of shaping better policies, and really trying to create a world for all ages. So just a huge thanks to all of you for being available, being present, and we will share all of the materials after the event. Thank you very much.
Thank you very much, everyone.